Community Safety Strategic Plan and our meeting with our Public Safety Advisory Task Force. I'm Wydell Holmes. I'm with the Office of Strategic Management and Diversity. And just wanted to let you know that we are recording the meeting today in our conversation. We would like to do this in order to share it with our community. We'll post it on our Community Safety Strategic Plan website, as well as for a later broadcast on Tempe 11 with our communications team. And so with that, we will get started with our agenda this evening. So first, I'd like to welcome our Mayor, Corey Woods.
Thank you, Wydell. Good afternoon, everyone. I wanted to say hello before we get started today. And just wanted to make a really quick note. I am actually out of town until tomorrow morning, so I'm not in my normal space, and the reception here is terrible. So probably after I kind of give my opening statement, I will go off video just to make sure I can preserve my phone battery and make sure I can still be on the meeting and not get kicked off of Teams. But just wanted to let everybody know, if you don't see my face, I'm still very much here and listening to the discussion, and will absolutely chime in if necessary. But just wanted to say once again, thank you. Really appreciate your continuing involvement with the Public Safety Advisory Task Force and all the work that we've been doing. I'm really excited to hear, what our staff, our Deputy City Manager, Police Chief, and others will have to tell you about a lot of the progress that we've made over the last few months based on suggestions that have been made by the members of this group. So just really appreciate your continued time and volunteering to be part of this very important effort on behalf of the City of Tempe. So with that, I will go ahead and go off camera, and I will turn it back over to our Deputy City Manager, Rosa Nichowski. But once again, thank you so much, everyone, for being here. We really appreciate your time and your participation.
Thank you, Mayor. Thanks for joining us from Florida there. So I think some folks are still joining, and then Wydell will take care of making sure that folks get admitted. But once again, I think we might have some new friends on this call. Rosa Nichowski, Deputy City Manager for the City of Tempe, thank you for joining us today. And I know we have a very aggressive agenda with 1 hour just to give you an update on what we've been working on since we last met. And what we decided to do is actually have each owner of those areas, of those pillars, give the update from their perspective. And they're the ones doing the work alongside of their colleagues, but they should be the appropriate person to give the update. I just wanted to make a mention that Sonia Blaine is our city attorney, and I wanted to make sure and welcome her and introduce her. And I think our CFO, Tom Dunsing, interim CFO, is here also, and Mark Day, our budget director. And I don't think any of you have met them before, but and there's Mark and his camera. Thank you for joining us. And then we will have Kathy Masters from our police department also present, and I don't think you've met her before. So we'll go along and start our agenda. And first off the top of the agenda is mental health and Solari update under the pillar police model and accountability. And I believe our Deputy Director from Human Services, Paul Bentley, will be providing that update.
Good afternoon, it's Paul Bentley. How are you? Thank you for the invitation back. The update on this topic that you see in front of you is specific to the component of implementing a mental health response team as part of the Human Services Department and Care7 program. And so what you see in front of you are the specific program goals and how it relates to also our mobile response and our case management within the system. Again, this is intended to provide a mental health response throughout the community whenever that need may arise on a 24/7 basis, but this team will be, with its component, be a part of that overall 24-hour availability. I think for today, what's extremely important to communicate is that this is a part of the integration into the partnership with the police department and Solari for 911 calls that come in that are mental health related. And so this will be the team, as well as other components of Care7, that will be responsive to those calls coming in from 911, as well as non-emergency calls coming in as well that have a mental health response need. So just for clarity on how it fits within the overall plan. The program itself, in order to be a part of this system, needed to become a part of a behavioral health provider. And since we last spoke, they have been approved by Access as a provider. and currently working with our Regional Behavioral Health Authority, or Mercy Care, on the specific negotiations for them to be dispatched through Solari. And we're within, we think, a week or two. I'm sorry, Chris Charlotte, who's on the call as well, probably 3 weeks to give her some room before that gets finalized, but we're moving very closely to that. And that's part of the implementation for this year. Also this year, through the support of Mayor and Council, the staffing was approved. And so currently there are 3 full-time staff members approved for this team. The original ask is for 4, and we're getting very close to that. That's a big lift within 1 year. And so we're very appreciative of being able to move this to those 3 positions. And so this is providing you some specific details of those positions, in which some of them are full-time city positions, some are wage, and that we have the intention over in our future growth of adding a full-time position and converting a wage position to a staff position. So a little bit more nuance than many would need, but for some that's important to know. In addition to supporting of this case management or this mental health response is case management. We utilize multiple funding sources in the city for many things. And specifically here, we have 2 grant-funded case managers, which have been brought to us through gaming grants to support this initiative. And then over time, we're wanting to convert those into citywide positions. So this is creating something that was not there a year ago and having it established to this level within the months that we've had, and also the future growth. One of the questions that has come in specifically is medical and medical support. And so just want to respond to that quickly. Is that specific to medical professionals co-responding with human services, either Care7 or HOPE? Human Services partners with our Tempe Fire Medical Rescue on many things, and our Tempe Fire Medical Rescue instituted its community medical program in 2015, known as Patient Advocate Services. This program serves the entire community, inclusive of individuals experiencing homelessness, and they are a huge partner and a leader for us in regards to providing those services to our community, and we work with them in that manner. In addition to that, Tempe Fire Medical Rescue leads our city's FUSE initiative. FUSE stands for Frequent User System Engagement. This initiative identifies individuals who are frequent users of emergency services, such as medical transport, emergency room utilization, and they create proactive support to provide proactive care, meaning that the results of this partnership with Tempe Fire Medical Rescue is that there's a greater quality of life for the individual, as well as reduces the overall use and cost of the emergency system. Thank you, Rosa.
Thanks, Paul. Real quickly, Paul, I just realized some folks on the call may not remember or reading the press release, and I know we gave a brief update on Solari. The conversations with our Public Safety Advisory Task Force and recommendations were really looking at who are the best folks responding to certain calls. And can you explain in 1 minute or less Solari and why this is the innovative contract or partnership with Solari and the city?
The system that's being created that well, one, it's in place to a certain degree, and we're adding Care7 is I think a fantastic concept. 911 calls come into the city's police department. If it's a medical response, or I'm sorry, mental health response need based on a partnership with Solari to make that determination, those calls are then diverted from PD to Solari for triage. And so it's taking 911 mental health calls and diverting them from the police department to a provider. Solari is that hub to take those calls and then triage them internally with their staff. What they do is they are stating that they are able to triage about 75% of those calls and handle it within the system of their own call takers within their system. And then the additional remaining 25% then get dispatched to a provider. Care7 is in the final stages of being that primary provider for the city of Tempe. So we're ensuring that calls are being diverted, that those who are experts in the field of mental health are receiving those calls to respond to. And then when we are absolutely in the need for dispatching specific staff, we have Care7, which has been in our community for decades, in this new mental health response team, providing that response with some supports if needed, and then additionally providing case management and follow-up to those individuals so that we can help reduce the number of individuals that need to be responded to repeatedly through emergency response, and we are more proactive in that response.
Thank you, Paul. I appreciate it. So the next screen that you see is the strategic direction, restructuring public safety roles and calls for service, which is building on what Paul just shared with you. I know I had mentioned once before we were approached by Grand Canyon Institute, ASU, NAU, and various divisions of those organizations to partner with us on reimagining what 911 could look like as far as right person, right call. I just wanted to give you a brief update that we continue to work and have the data agreements. They actually just took a tour of our dispatch center, Solari and Care7. So we are continuing to work and refine how that partnership helps identify some outcomes for us regarding the 911 cohort. Please stay tuned because we are looking at making sure that data exchange happens. Thanks to Mark Wittenberg from our IT department. And thank you to our police department for helping to share that data. That's going to hopefully identify some innovative ways of 911 dispatch. So stay tuned for that conversation. Next up is Chief Glover.
Good evening, everybody. So for the police model and accountability, our strategic direction and restructuring public safety roles and calls for service is emphasized by what we call the 3 C's. And we emphasize listening to members of the community to address evolving societal concerns. Our principles are grounded by incorporating what we call the 3 C's in community policing, community engagement, and collaborative leadership. And as you can see on the slides, community policing is about evidence-based strategy and neighborhood policing and principles of problem-oriented policing. Community engagement, which is building strong community alliances and trust and legitimacy. And our collaborative policing, our collaborative leadership, which is internal leadership alignment, good information and good intentions, authentic strategies and shared organization and community goals. This is all to work in harmony with the vision for the police department, which we conducted a department-wide staff study to analyze staffing needs that would assist with providing exceptional service to the community. And it was determined that creating additional non-badged positions could serve multiple purposes. A committee was formed that delved into the role and responsibility of police aides at the time. Specifically as it relates to routing non-emergency calls for service. These highly trained employees have provided exceptional service to the community for many years, but there's been just not enough of them. And the results of having them is the increased positive contacts with community members, decreased criminal activity focused on community-oriented policing, increased time for specialized training in mental health and de-escalation techniques, reduce response time to emergency calls, and the increased in employee mental and physical wellness. The addition of these positions were approved by city leadership, and after meeting with members of the community and based on feedback from Public Safety Advisory Task Force, it was determined that the name of the police aide would be changed to community responders. Hence, on November 16, 2021, the name was changed and the role of the position were identified. And on January 11th of 2022, it was determined that the police would extend the role of community responder to human services. A pilot project was proposed initiating neighborhood ambassadors for the community responders who will work with human services to address the quality of life issues related to homelessness and displacement during a crisis and divert calls as part of utilization for these positions.
Thanks, Chief. And Mayor, I hope you don't mind if we share a little bit about how this whole idea came about. Was actually a conversation the Chief and Mayor and I were having regarding police aides and what modern cities need to think about that's occurring in their neighborhoods. So we receive a lot of information regarding things that are happening in our parks, in our neighborhoods, in our alleys. And we thought, really, we need some neighborhood community responders. And then actually we met with our parks deputy director, Craig Hayden, and came up with a great idea of saying, if these new ideas of community responders are actually being proactive and they're looking at all the things that are important to our neighborhoods and our neighbors, from parks and recreation and our alleys and the condition of our alleys, or crime prevention through environmental design, then they really are our neighborhood ambassadors to our cities to help advance the priorities that are important to our residents and businesses. So that's actually the concept. And we will be piloting this in partnership with Shauna Warner and the neighborhood team and many of our departments to look at hopefully partnering with our Hope team and Care7 to look at what are the important things in our neighborhoods and be more proactive in addressing those. So thanks, Chief. Thanks,
Thank you.
Mayor.
Thank you.
Next up, we have Care7 Expansion, Paul Bentley, and I think you have the Family Advocacy Center also update.
Rosa. And so within the Public Safety Advisory Task Force recommendations was significant consideration of expanding and increasing funding for Care7 and their programs. And so this slide represents specific areas in which that is occurring, while there are other areas that Care7 is involved in that you are not seeing. Specifically, the Care7 Crisis Response, which is the 24/7 program that responds with police and fire and also independently to provide services throughout our community. The existing program, there is a need to add an additional full-time responder. And so within our fiscal year 23 supplemental process, that position has been asked for. And so we'll see how this current budget process works out as far as its completion, but that is in the budget process. Again, the mental health response team went from a staff of 0 to a staff of 3 with administrative support this year. And so we're working towards completing that process within the upcoming years of adding one additional full-time responder to be a part of that team. But again, we went from 0 to 3 this last fiscal year with administrative support and looking to continue to finalize that system as you see in this slide. Case management, we do. Sorry, was there a question, Rosa? No? Okay. Case management. Again, the case management, which is the follow-up for individuals in our community to help provide supports in many different ways from a social services perspective, is currently funded through grant dollars. And over time, we'd like to turn that away from being reliant on grant funds into other funding sources in a more consistent manner. But we're not there yet, but heading in that direction. The high school youth specialist program has grown just phenomenally over the last 2 years. It went from a program of part-time staff that now there is 7 full-time staff that are actually being converted from temporary staff to full-time city positions, which again is in the budget process for this year. And should that be completed, that will happen this year, as well as 5 positions that are on a 2-year cycle that have been added to that program. So significant growth there, as well as our elementary school youth specialist program. Using CARES Act funding, there are currently 6 positions that have been funded through CARES Act fund to provide social and emotional supports to our youth within our community. And then not shown, our victim services program, which is VOCA funded. And I'll talk a little bit more about that in a few minutes. But our victim services program, we are in the process also with a supplemental to have those positions that are VOCA funded to become city positions as well, still being grant funded into the future. So significant growth happening in Care7. Tempe Family Advocacy Center. Very briefly, just as a recognition of what this Tempe Family Advocacy Center is intended to do. Family advocacy centers are national best practices to serving victims of crime. They provide trauma-informed services by centralizing all victim assistance to limit the re-victimization of individuals and families. In Tempe, those services are not easily available currently to those that are traumatized by crime, as community resources exist in various locations, and individuals must traverse from location to location. For this functionality, for this center, the intention is to centralize those services to include coordination with law enforcement and the Department of Child Services, medical services, counseling, interviewing, family support services, including supplies such as food and clothing, and appropriate administrative and training facilities. So this is intended to centralize all of these functions and needs for those who are victims of crimes from a trauma approach, to ensure that we are able to meet the needs of individuals who have been victimized in one location and in one space. So some key components of a family advocacy center, again, providing all these functions in partnership with the Tempe Police Department and Arizona State University within this one location. That will have areas for counseling services, for trauma-informed services, healing, as well as many other services within this location. One of the questions has come up in regards to funding for this. And so we're happy to report that Tempe leadership has dedicated their time this past year in support of the Family Advocacy Center and have done a specific event and have had a very successful event to help provide needed resources for the Family Advocacy Center. And in addition to that, our victim services program, that program is funded through VOCA, or the Victims of Crime Act. And so while those positions are intended with this supplemental, if approved, to be converted from temporary positions into full-time city staff, still funded by VOCA. And so the intention here is just to communicate that we're looking at multiple funding sources to help this, including ASU, which has come to the table to provide assistance as well through funding to help bolster this program. The current status. So a lot of effort and time has been placed, but the current market is making it very difficult to lease a location. And we have many stories about that, but all of the work that has been done to date has solidified our space plan for this facility to ensure that we have the right space usage for those that are being served. And we're currently looking for another location to go into negotiations with for a lease agreement. In addition to that, we also want to speak clearly about our partnership with Activism Ministries, and that we're actively collaborating with them to develop outreach to underserved communities. And again, we are looking for a location right now. We have a few that are out there, but the current market, again, is what it is. And our intention is to keep the team moving forward, identifying locations as they become available, research them, and hopefully get into a lease agreement in the very near future. Thank you, Rosa.
Thanks, Paul. Turn it over to Mark Wittenberg for data update and transparency.
Great, thank you, Rosa, appreciate it. So in the data and transparency pillar, really this project is going to be broken up into two phases. In the phase one, I call it the request for a proposal, but it's actually really an assessment of where we are today. It's like, what data gaps do we have? Are there policy gaps? Recommending an architecture. And the way I kind of describe it is, imagine that you're building a house. And so the first phase of this is really building those architectural diagrams for which to build the home. And then the second phase is to actually build the house, which is build this platform or this system that we can now house data from various sources. So taking data from police, from courts, from human services, from fire, from Solari, these different areas, to be able to build this framework and then publish data. Now, I know if you look at the timelines there, that you might look at it and go, okay, well, what's being done today? Well, actually, there's a lot of work that's being done. One of the first things we're looking at is we are looking to find a vendor to come in and to help us with this data assessment and to really understand what data do we need internally, and then also what data do we need to publish externally as far as that data transparency. And so it's somebody to come in and help us. So we have an RFP that's actually out on the street, and we're in the process of reviewing those responses. And I have to say that our procurement office has said that we received like the most number of proposals for any RFP. So there is a lot of interest from partners to come in and do this work, because it's just, I think it's just so important, and it's also, I think, going to be a model for other communities as well. So we're in the final throes of getting that partner selected, and so we can hit the ground running in July, which is when we're hoping that the funds will be available. So that's the other piece of it, is that We have a request in for the budget, which is in the green, to be able to fund both of the phases to move these forward. We've also published a couple of dashboards. We published our hate crime story map, which is information about just hate crimes that are happening in Tempe, and really telling a story about not only the data, but just the information that's being provided. The next thing that we're going to be publishing in June is going to be the employee demographics, and police is going to be part of that, but we're actually going to be publishing the entire city employee demographic, and then you'll be able to go down by department and break down the demographic by department, which would include the police department. And then we're also working with the various departments. You've heard a lot of information about the different cohorts and the different groups and different departments that are working together. And so we're constantly in conversation about what data do we need to be able to inform decisions, and then what data do we need to publish for that transparency with you all. And then the final thing I would say is that as we build this forward, we're ensuring that that this is something, as we build the house, we want to make sure that the PD data is the focus, but that it can be used for other data within the city as well, and so that it can be repurposed. Thank you, Rosa.
Thank you for that. And I know Genevieve just joined, and she probably would agree that the reason for all this work regarding data and transparency is data builds trust, and we recognize that at the City of Tempe. One of the early conversations Mark and I had, and Chief Glover, was with some other cities as far as what their data portals look like, what their dashboards, and unfortunately, many of them were mandated to create those by consent decree. And one of the things we've said is we're in this space because we want to. We made these investments. We want to make sure that everything is public, but it takes a while. So building a home, there's a lot of vision and design process and a lot of intersectionality with other data points from other cities. So it may feel like it's slow in the beginning, but once we get this going, hopefully we will see the fruits of our labor very soon. Communication or community engagement. Nikki, I'll turn this over to you and Chris Baxter.
Hi, task force members. Thank you. Nikki Ripley, Communication Manager. We're making great progress on a series of videos that we're editing now and set to release later this spring. And Chris has some brief details on those.
Hi, everyone. We are so excited to be working on this. The work that everyone on this task force has done has been really forward-looking and inspiring. And we wanted to capture that, not just for the residents of Tempe and the businesses here, but for other police departments and human services departments and human resource departments and data-driven cities that want to see how they can improve their police department, their city overall. And when we really got to look at all of the things that the task force had accomplished, we realized this was a vast project. We've spent probably about 30 to 40 hours visiting with a lot of different people. There are at least, several of them. Anyway, when we looked at all of these different groups, we realized that we also needed to add community members. And so we stood outside Tempe Public Library for part of an afternoon and just asked people as they were walking by, what does feeling safe mean to you? What does safety mean to you? And got a lot of answers that we included as well. So that was part of what we did. And on the next slide, you'll see some of the videos that are being accomplished. So right now, our videographer, Jason Wolf, is in the process of taking about 40 hours worth of video and narrowing it down to about 30 to 40 minutes worth of video that is completed and beautiful. And we basically took a look at everything you did and came up with these buckets of information with the theme that community safety is a function of everyone, not just our police. And as our community has evolved, so have the needs of our community safety. These videos won't just go on our local Tempe 11 TV channel. They will live on our community safety webpage. We'll be sharing them out on social media. We'll be sharing them out hopefully through our members of the media, and asking that if you like them, that you can share them with your friends and family as well. We'd like to think that it will be an incredible reflection of all the things that you've done, which are so amazing and so vast. That's it.
Thanks, Nikki. Thanks, Chris. And then finally, we have, or second to last, workforce culture and wellness. And this is Kathy Masters, Assistant Police Chief, Director of our wellness and our workforce culture. Kathy, welcome.
Thank you, Rosa. So our wellness coordinator position is designed to develop, resource for, manage, and measure the programs for all of our employees, be they sworn or professional staff. And it was open through human resources. However, the unique challenges of public safety wellness, the Craig-Tiger Act, and other challenges limited a pool of qualified candidates. So we went back to the drawing board and the qualifications were updated and the position is currently being reposted. In the interim, we have temporarily assigned a sergeant to run the program to ensure continuity of services for our personnel. We've extended an outside contract with wellness services to assist in the transition. We've also continued our relationship with the 100 Club app. We also have a plan to restructure our psychological services contract once the coordinator is in place. Tempe PD is in the final steps of accreditation through ALEAP, which is the Arizona Association of Chiefs of Police, Chiefs of Police's law enforcement accreditation program. Obtaining accreditation requires a deep dive on policy, including implementation of an early warning system. Directly from our policy, it's the intent of the department to ensure employees are proactively offered support services and guidance when situation exists, which have the potential to adversely affect the employee's work performance or department operations. And this places a greater emphasis on identifying employee issues, whether they're on duty or off duty, before there's an adverse community interaction. And so looking at Craig-Tiger, that's the next slide. It's the policy of the department to assist employees in maintaining healthy levels of physical and emotional well-being. The department recognizes the employees are exposed to critical and traumatic events during their duties, and we're committed to providing resources and services offered under the Craig-Tiger Act. The Craig-Tiger policy is available as a public-facing document through the tempe.gov website under the police subheading. Implementation of the policy has been generally successful, and the police department continues to work with our HR and risk management partners to identify gaps and best practices. PD, risk, HR, legal, and peer support also collaborate on emerging issues and long-term issues to provide proper support to personnel, both sworn and professional staff, to make sure that our officers are well cared for, our professional staff have ongoing support through the Craig-Tiger Act as well as our benefits. Thank you, Rosa.
Thanks, Kathy. And then finally, our last pillar is the environmental design for safety. And you've heard me talk about the importance of prevention through environmental design. Cities have a great opportunity working with community development and our other departments to look structurally at what are things, as Chris Baxter has said, what is our community saying as far as structurally, what are some things that help people feel safer. It's not just the walkability, but how is that walk, how does it feel to go on that walk and feeling of safety in our city? So Sean DeFara is an employee working in community development who has been actually piloting many of our initiatives regarding CPTED in our North Tempe neighborhood with great results, feedback from our residents. And I know that Andrew is going to talk about, our city manager is going to talk about our reorganization, but part of that reorganization is definitely going to have a build out of environmental design for safety and looking at that structure and expanding those roles in Tempe. But before we move forward to the city reorganization and budget, I thought perhaps this might be a good pause to ask for any questions regarding the pillars and the updates that staff has provided for everyone. I know this group is not shy, so anyone can jump on in.
It looks like Councilmember Kubi has her hand up.
Yes, I guess this is a question for Mark and for Chief Glover, but the data gaps that are identified, that includes the demographic data at traffic stops and traffic, and also any stop, I should say. I know we're probably doing it for citations or for arrests, but includes demographic data for traffic or police stops.
Yes, that is correct. That's one of the things we're working on right now. And I didn't mention it, but we're in the process of deploying an electronic citation and accident reporting system. That's currently in process. And as part of that, we'll be developing not only the data, but also the policies and how do we collect that data. So that will be part of the discussion during the phase one is exactly how do we set up the policies in order to address that particular gap. And then the idea is that we want to make sure that any touch point that we have with the community that we're collecting that data. And so it's looking at all of the different data, like ensuring that Solari, as they work with diverting those calls, that they're collecting that data too, and that we can get that single big picture. Chief, anything to add there?
Mark, I believe you are right on point.
Well, just I want to say thank you, because I know that was a community desire that came out through the process. So thank you so much for attending to that. It's important to have that demographic data for stops as well as arrests, of course. Thanks.
Yeah, hello, this is Keisha. I was reviewing the city manager's budget recommendations and noticed that the only thing that they cut funding from was the $88,000 position from the Crisis Response Network. And I was curious as to the thought process behind that.
Keisha, I'm not sure which position you're speaking of. In PD?
Can you hear me?
I can hear you. Can you clarify which position that you saw? It was in Human Services?
Rosa, this is Mark. If I could clarify, in Human Services, in the not recommended was a crisis intervention specialist position.
We're talking about Solari, the Crisis Response Network. It's $88,000 was in the police department. You also didn't recommend mental health specialists for Care7, which we also had questions about, but this was a question about why you didn't fund Solari if it's part of the public safety task force.
Can we go back to that first slide of mental health? Because I think it did show what was being funded through Solari. Just to clarify. So it shows two full-time positions and one wage position. With that wage position, a future going to full-time and then another wage position being added, right? So there is funding for the mental health response through Solari. Not through Solari, but working with Solari.
Paul, do you know the answer? Bentley?
I'm here. And so to clarify, the original request for the mental health response team was four full-time crisis responders designated to the mental health team. This current fiscal year 22, 3 positions have been created of the 4 that were asked for, 2 that are full-time positions and 1 wage. And so as the question came up, there's 1 additional position that was asked for that has not yet been funded. That is correct. But there were 3 out of 4 funded this current fiscal year. I'm not sure. I'm trying to answer the question as clearly as I can, Rosa. I see your face.
Can I add to that, Paul? Can I add to that some detail? This is Chris.
Please, Chris.
The supplemental was for the 4th full-time position and to convert the wage position to a full-time position using the wage as an offset. That was what that supplemental that Keisha's referring to. That's what that request was for. Even without it, we are able to get started and then revisit that next year.
What I was just going to say, thanks, Chris. And I know Andrew's going to give an update on the city reorg and the budget, Keisha. And one of the things that we've discussed is looking at kind of moving forward with the new budget year, when we would allocate some of the things that we have put a pause on, making sure that we get through the recession. So there has been some method to, what we're going to approve or what the mayor and council can approve, are going to approve, and then looking at this in the fall again. But I'll let Andrew discuss that. And maybe, Andrew, we can just jump into that.
Yeah, thank you, Rosa. Hello again, everyone. Sorry, I was a little late. I got double booked this afternoon in meetings. I also want to apologize in advance. My vocal cords are a little strained today, so I'll try to talk less and we'll see how that goes. That's not always a successful strategy for me, but I will do what I can. So the slide you see in front of you contains a couple of bits of information that I hope that you find interesting and relevant to the Public Safety Advisory Task Force discussion. One is on the left-hand side, you'll see an org chart. And in this chart, what we have is a reorganization plan that I presented to council and to our city a few weeks ago. And what I've attempted to do is a few things with it. And I'll speak just at a very high level about what it is that I'm attempting to accomplish. One thing is that I wanted very much to make sure that our city organization was in alignment with our council's enunciated strategic priorities. So you'll see city manager, and there's one of the council priorities that's listed under that title. And then going from left to right, you'll see 3 deputy city managers at the next level. And each of them has at least 1, and in some cases, 2 council priorities. There's a total of 5 council priorities. There's a total of 4 city manager and 3 deputy city managers. So it's allocated across the departmental level through our deputies. The second thing you may notice is we are now adding permanently a 3rd deputy city manager. As you know, we had 2 last year. We promoted temporarily, at least initially, Rosa Chowsty to be a 3rd deputy city manager with 2 main functions. One was to sort of marshal all of the city's forces with respect to COVID response and recovery. And the second was to make sure that the recommendations coming out of the Public Safety Advisory Task Force were fully implemented. And so it's noteworthy that as we continue to report back to the task force about our progress, that we can also note that this 3rd deputy position is going to become a permanent position within the City of Tempe organizational structure. And spending some time on that side of the chart, which is the right side, you'll see it says CIO. What that means is Chief Innovation Officer, not Chief Information Officer, because that's more of our information technology. But I'll get to that in a second. You'll see that it's a chief assistant position, that it's meant to be in charge of strong community connections. And I think at its heart, the efforts of the Public Safety Advisory Task Force is intended to be consonant with the idea of the City of Tempe doing better in figuring out its role with the community and how the city and its organization can better serve the needs of its community. It's a very diverse community. So you'll notice a few of the departments and offices that we have placed within that chain of command, within that new deputy position. One is community development, and Rosa already spoke about that with respect to how the CEPTED, crime prevention through environmental design, philosophy and tenets are already contained within that department and are often part of our planning process and our security planning process. And so that is certainly an element that makes a lot of sense to be reporting to that deputy city manager. You'll also see economic development. I think we can agree that the economic activities of the city, whether it's in partnership with the region or individually, has an impact on the community and its well-being. And it makes a lot of sense for that to also be within that area of the organizational chart. Information technology is there because, again, like I said, this position, this new deputy position, will also be in charge of working in the innovative space. And the reason I want to underscore that is I think many of you may know that Mayor Woods was invited last year to be part of the 38 city cohort as the city leadership initiative for the partnership between the Bloomberg Foundation and Harvard University. And so as part of that, Rosa and I have been working with on the management track there to bring forward an innovation program to the city of Tempe with the assistance of the faculty at both Harvard and at the Bloomberg Foundation. And that work is underway right now. So we're hoping to kind of memorialize a culture of innovation within the city of Tempe. And be candid, one of the reasons why that fit makes sense is that much of the work that has been done and the fact that we, through the actions of Mayor Woods, had created back in late 2020 a public safety advisory task force and had worked with that task force to come up with these recommendations, many of which are in fact innovative in that space, is very much consistent with what we're attempting to do in the larger sort of organizational direction of the kind of organization that we aspire to be, one that embraces and rewards innovation in many ways, including innovating the way that we think about public safety and community safety and concepts of what truly can make a community safe over time and whose responsibility that is as well. So that's why that's there. And so the information technology or IT area certainly has a large role to play in the leveraging of technology in service of the needs of the organization and also the needs of innovation. And then lastly, of course, this is an area that that was formerly known as diversity and strategic management and diversity. We are formalizing that innovation piece within that office that's currently occupied or work that Wydell works out of. And you'll notice that the Chief Diversity Officer is now a manager level report as its own entity, reporting directly to the city manager on issues of diversity, equity, and inclusion. It's probably been noted before I got on the call today that our diversity manager, Janae Harrison, unfortunately left the city of Tempe to take a job in the private sector. But she left us in good stead, and we're looking forward to having that new position filled expeditiously with someone of a similar caliber to Janae, and that position will report directly to city manager. The other quick thing I'll note is that a lot of the direct reports to the city manager are now going to be reporting to this assistant city manager position that's higher than a director, but not at the same level as a deputy. It'll be another direct report to the city manager, and will include our communications team, 311, marketing, our government relations group, our mayor, chief of staff, and city council aides, and our mayoral aide. And although it's not on here, the intent is also that this position will also have our new veterans coordinator, and and we are presuming the animal welfare position will also ultimately report through that chain of assistant city manager. So a lot of changes contained in that chart. Happy to go over it here in a minute. Quickly, I want to move to the right side in blue on budget. A couple of items of note as we move through our budget process. As part of a mid-year approval, the city council approved the expansion of human services. That includes an expanded array of services, greater shelter options, including the city purchased the old roadway inn this year on Apache Boulevard that has 50 units of non-congregate shelter added to the 50 or so that we had on a long-term lease at the Super 8 Motel further west on Apache. So we have a number of non-congregate shelter for people who are experiencing homelessness. We've also added a number of positions to Human Services to expand the HOPE team, which is the homeless outreach team, so that we can continue to combat and to try to solve homelessness within the city of Tempe, and also working with our regional partners. Second bullet I want to spend a little bit of time on is the restorations. One of the priorities of this year's budget is to restore positions that had previously been frozen because of the pandemic. As you'll recall, the economy took a very sharp downward turn at the beginning of the pandemic in March, April of 2020. And we were unsure at that time, because it was in the middle of our 1920 budget year, what the long-term effect would be. So we had all departments freeze a number of positions. And we told them that when the time was right, they could ask for those positions back, but that we would not automatically unfreeze them. And so over the course of the next 2 budget years, including this year's cycle, departments have worked towards evaluating positions and looking at which ones ought to be restored and which ones maybe shouldn't be restored in favor of new positions, and which should perhaps just not come back at all and or come back in some other form. And the bullet underneath restorations, I want to highlight, because the police department in this year's budget made a conscious decision, and there are a number of positions that would otherwise be eligible for restoration, which included a number of sworn police officer positions, to instead begin to staff a new model that includes a shift to community responders when they work out of the police department, which are civilian positions, not sworn. These are positions that will not are not authorized to use weapons or guns, to community responders to respond to those he calls that are appropriate for that level of response, and neighborhood ambassadors, which are those positions that will be embedded in our human services as an attempt to shift some of that responsibility for public safety, community safety, to a lot of other actors within our city and our community, including human services, the police department, our fire and medical rescue department, and a number of other actors, as well as the community itself. So that's a pretty significant shift, and it's something that they undertook in being tasked with looking at whether or not to otherwise restore positions that were frozen, that were in fact at the time sworn positions. So I know I covered a lot of information in that slide. I think we have at least one hand is up, and I'm certainly happy to answer questions.
Yeah, so I heard you mention this as well as Chief Glover. So not only are you going to have ambassadors under the health services program,
human services
or department, but yeah, I mean, sorry, but we also have non-sworn officers or civilians still operating under the police force, correct?
That's correct, yes.
Why are we still using that approach when we can just move those resources and attention towards human or health services or what have you? Why are we still utilizing police services as a way to engage with the community for life-threatening situations and in dispatches and things of that nature? Why not just move that information or move that energy over towards the alternative in terms of ambassadors? Why are we still using a form of policing as a method for engaging with the public when, again, there's no lives, there's no life-threatening situations that they're being dispatched to for that specific call?
I appreciate the question. I see Chief Glover is come on to help answer. I'll start the answer by saying that this was a concept that was formulated by the chief and his team as a way to sort of reimagine the functions within the police department. And as part of that reimagining, that included these positions being in the department. I wanted to, in recommending this budget to the city council, wanted to give him an opportunity to have this go into effect and to study whether or not it's an effective model. And that was his vision. So I'll let Chief Glover expound upon that. Sure.
But before you pass the microphone over, like,
Sure.
why not just utilize that alternative to begin with? Again, so why not just streamline police services by, assigning them to life-threatening situations, to dispatches that call for that type of service? If you have nonviolent victimless dispatches, that should be tended to by ambassadors, by people who have no affiliation with police services, because that's an incongruous work philosophy, is it not? So I've noticed in different cities, just from a universal perspective, if you have people operating under the umbrella of a specific environment, first responder unit, they're going to use that philosophy. And there's certain dispatches, there's certain times where that form of care cannot be, you cannot approach it from the perspective of policing, whether or not it's a sworn or non-sworn position. You're still approaching it from the standpoint of a police department. So I'm just asking why we're still using that as a method of like alternative services to having someone with a badge and gun show up. It's still the police showing up, and it's still an issue at the end of the day.
Again, I understand your question. Like I said, this was the model that Chief Glover recommended, not badge and gun, but people who are working in civilian capacities, responding to calls that are appropriate for a different response than a sworn officer response. That's I wanted to be able to support trying to see how it worked first, and to evaluate. One of the things I think that's important in opening up this dialogue that we did in 2020 to have a public safety advisory task force is to report back and say, this is what we attempted to do, and it was either successful, and we understand what the metrics of success are, or it was not, and we should alter our approach. I did see that there was a question in chat. I just want to note that the positions, just to answer the chat, and I'm going to let Chief Glover expand. The positions I'm talking about that are being restored, there's no net new increase in positions of those restored positions. They're simply positions that have been frozen for a period of time since the beginning of the pandemic, and that I'm speaking of the ones that are being restored as FTEs, even though the vast majority of them are being restored as something other than a sworn police officer. So I'll go ahead and turn to Chief Glover. Go ahead.
Yeah, thank you, Andrew. I think, Jacob, for, I guess, a response to your question is that you have to start someplace. And when you're looking at shifting services to other entities, one thing that you have to think about is that even if the services that you're providing is going to be shifted over, you have to keep in mind that if it's nonviolent, you still have victims. You still have people that are reporting crimes that have been traumatized. Even if it's not a violent crime, and that you still have to train and certify individuals to be able to take and be able to respond to those kind of calls and reports. Even if it's a vehicle collision, or if it's a property crime or a forgery, or things that we would deem to be, reasonable for a unbadged person to respond to. So there's the aspect of this where we want to try this model out to see if we can slowly start to integrate those things. And so you have to do it sometimes incrementally. This also means that person has to develop and be able to create partnerships with county attorneys and things of that nature, because these are all cases that have to be submitted. So there's more of a complex system here than we just take and just scrap everything and just throw it onto somebody else's plate. So it has to be done in a way that we are training and providing people a way of how to be able to maneuver in this lane. And again, I know that, on your feelings on the community engagement piece, but even from a standpoint of individuals who are in a non-badged role that provide that help to provide that bridge and that connection for police departments to be able to do that kind of engagement is of I think it's of great and value and importance for our community members, because there's a lot of community members that still want to create and develop that relationship with its police department, and they can also help be the face of that. It doesn't have to be somebody that's carrying a gun. So that's why we are embarking on this mission and developing this program to look at how we can actually assure that we can create this neighborhood ambassadors as well as our community responders to have this expanded role.
Lauren, I see you have a question as well.
I'll wait until Laura's
no.
done, then I'll circle back around.
Oh, I'm sorry. I'll just get quickly to citizens of Tempe, the top box. We had talked about changing that to residents of Tempe to include, the undocumented asylees, refugees.
Yeah,
So
no, that change, this is still in draft form. So
Okay,
I'm going to
great.
be adding in the positions I talked about. So it'll either say residents or the Tempe community, something like that.
Thank you.
Sure.
Sorry, Jacob.
Oh, no worries. I was taking up the microphone. So, from your perspective, let's say that there's some sort of positive reaction from not seeing badged officers and things of that nature in people's neighborhoods for things that don't really require it at the end of the day. Because, again, from my standpoint and the standpoint of a lot of individuals, we really don't need to see them for anything other than stuff that involves, victims or violence or things that, they're just like an existential crisis or something like that. So let's say that, this new program works and we see a positive result. Would that be an opportunity to take what what you guys have planted into the ground and grow this into something that is a outright independent first responder unit that would take care of victimless nonviolent dispatches that would be seen by that would currently be seen by the non-sworn members of the police department as well as the community ambassadors? Why not consolidate this into its own first responder unit, incorporate things such as HOPE, and you have an opportunity to access things from a professional standpoint that don't necessarily involve police force or anything of that nature. Do you see anything like that taking place in the future as this program develops and this new we embark in this new direction as a city?
Absolutely, Jacob. I'm going to chime in because your words were resounding when we had our Public Safety Advisory Task Force, and you and I have had conversations about how do we reimagine who takes care of our community. And those were the conversations that Chief and I had, and the mayor, and talking about with other staff, our parks, our HOPE team, our human services. We had an internal meeting saying, okay, this is kind of edgy, but let's think about what this could look like, right? Folks who are really taking care of our community. And what we envision, quite frankly, Jacob, what we talked about is eventually hiring folks within those neighborhoods, within those communities to take care of their own community. That helps us with the city, right? No one knows a neighborhood better than the people who are living in those neighborhoods. We know that. So the vision is that. So even with like 911, reimagining right call, right person, all these are moving parts to a very traditional government, and it's modernizing how we envision community safety. So please know that the words that you had shared here before were the words that we were repeating in our own meetings about what could this look like. But to the chief's point, things need, it's culture change, right? And it's changes as far as what people, even our residents or people, imagine. It's a change. So all of these are moving parts, from Solari to 911 to victim services, all of that. So I just wanted to say, Jacob, you were heard, absolutely, because those words were repeated in the meetings that we were having about the ambassador. So definitely we will be looking at the data, working with the HOPE team. These are folks who will be working hand in hand with Care7, HOPE team, our parks crew, and really shifting that work. Thanks.
And we have one more hand raised, Keisha.
Yeah, I had a question. So on one hand, it seems like we're going route with Solari and Care7 and creating like health providers to respond to mental health. But what was concerning was in the staffing study, which seems to be recommended to be fully funded, they're talking about creating a mental health unit in the police force. But we never, I mean, in all of the public safety task force recommendations, we never said that there should be police handling people who are suffering from mental health. It should be, you know, Care7 and Solari and people with a background in mental health, not police officers, which their very presence can be triggering to people who are already suffering mentally. So can you explain why they're developing a police unit to deal with mental health? It seems to be in contradiction with the human services response to mental health.
I'll go ahead and, again, I could paraphrase, but I'd like to give Chief Glover an opportunity to explain.
Yeah, so the whole concept of being able to have officers that are highly trained in the mental health aspect is that even as we looked at and talked about in the cahoots model, you know, you have the issue of, you know, whether or not you should have officers that respond out. At any given time, you're going to have a situation that's going to occur that the officer is responding out to, whether it be it could be a traffic collision, it could be a domestic violence call. You want to allow for people to actually stabilize that situation until you can get the right people there. And so with the mental health squad, you have the ability of having people that are specialized and trained in that area, in that realm, to be able to step in, stabilize that call. So a regular normal patrol officer is not dealing with that situation, who may end up, you know, creating or actually escalating a situation where they can help de-escalate and then turn that over to the appropriate staff and personnel to be able to take that situation. Really with this concept, it's being able to put people in the right places so that way they can deal with these situations and turn it over appropriately. We're talking about people that are highly trained, meaning that many of these individuals that are stepping into that role have some sort of background already in that field or that area. So we have officers that have come from social services background that have psychology degrees. We have officers that have law degrees. So if we have the right people within that particular unit, and it doesn't necessarily mean that they are actually the ones that are responding out that, you know, that look like a SWAT officer. These officers would be dressed down, more so plain clothes, responding out, just sort of like what you have seen in other models around the country that have been very successful, like in Austin, Texas. And so they would be there helping to stabilize the situation until we get the right people there to be able to deal with it.
Thank you, Chief. We have another question with Genevieve, please.
Not a question, surprising, more a comment. And I may have missed this because I had a conflict with the first half, is more along the lines of when you talk about the things you're implementing, I'm curious to see maybe for our next meeting, what is that success criteria? So how are you measuring whether you're getting that positive sentiment for that change in a program? What is the outcome you're looking to achieve? And kind of what are the steps that you would mitigate any negative sentiment, right? So I think that's what I'm looking for going forward, is each one of these things that you're implementing, what's the outcome, and then what's any changes that, like, how are you going to course correct if something's not measuring the way that you want it to? So don't need it for right now, but definitely something that I'm curious about for the future. Does that make sense? Okay.
Sure does. We speak in outcomes, so absolutely. We recognize the pillars are more of the outcomes, but you're saying distill it down to more specifics regarding what are we hoping these specific strategies will accomplish or help advance the needle on that pillar.
Yeah, especially as some of these are early on, and so you're baselining right now, right? So
Yep.
What does this look like for you going forward? And it doesn't have to be separate. It can be part of your updates and your presentation. But that is just something for me that I'm interested in seeing. How do we know that new model or that new program or that new approach is successful?
Right. Absolutely. Thanks, Genevieve. Mydell was good enough to pull up the slide, just touching base. You said about the next meeting. So we thought we would revisit where we've been. As we know, Mayor Woods courageously established this Public Safety Advisory Task Force on October 13th of 2020, if you can believe that. It really concluded with recommendations that you see on your right on June 9th, 2021, which is almost a year. Recommendations of the 5 pillars, 8 strategic directions, and the cadence of communication started November 2nd, 2021. And then obviously we are here now with our follow-up meeting in April as promised. We were thinking, not sure what the task force is recommending. We know that we have a dashboard that you have in your packet that gives the updates. We were thinking perhaps at the 2-year mark, having one more meeting in October, which would be the 2-year anniversary of the mayor's task force. Or I'm opening up the floor to see what people are recommending, or if you would like just the dashboard. And then I know many of you have meetings with us at the city for updates on specific strategies and pillars. Don't all jump in at once. The question is, would you like to meet one more time? Would you like us to give updates in another fashion?
Is there a way? I will only speak for myself. I would love to see more updates, but I'm totally open to multimedia versions of this. In other words, some, quarterly updates on progress. When you get the dash, as things come up, I think I would prefer to know as things come up as opposed to waiting 6 months for a meeting. Not because I don't think y'all are working on things, but there's not a lot of visibility to it if we're not on the front lines. So I think some regular updates, even by email, would be welcome for me, speaking only for myself, and I will of course make myself available to y'all if you have any other need for me to give feedback.
I'm kind of in agreement with Genevieve on that. This is Pam.
Thank you. Any differing opinions? Okay. Well, we can generate, actually from our dashboard that we have, can generate reports. We can try that and then continue some of the other meetings that we're having with some of the strategy groups and see how that goes. And communication, know that you can contact us anytime, and we will probably be following up with some of you that wrote some comments in the chat. Continue that dialogue. What you have before you is a 2022 City of Tempe Boards and Commission Appreciation. Mayor, council members, would you like to share a little bit of information? Because they're all invited to this, and I wanted to make sure that invitation was extended by you.
Sure, Rosa, happy to do that. And yeah, so the Board and Commission Appreciation event, we typically years ago, I remember when I served on the Transportation Commission back in 2006, there used to be kind of a celebration event for people who have spent a lot of time serving on all of our different boards and commissions, everything from historic preservation to parks and recreation, sustainability, transportation, development review commission, all of those items. And for a while, the event went away for a number of years. And one of the things that we, as we were talking to a lot of our residents over time, they would say, look, it really, if there's some way for the city to bring this event back to show appreciation for people who are frankly volunteering, as this group has done, hours and hours of their time for free, that there at least be some recognition of the work that they've done and some celebration of their efforts and their willingness to work with us to make our city a better and more inclusive place. So that is so we've decided this year that we are going to resurrect that board and commission appreciation event. It's on May 6th from 5 to 7 p.m. And we will definitely love to see everyone there. And I see Wydell saying that she's going to send out the RSVP link to the entire group. We would definitely love to see you there. And just love to thank you for your service.
And could I just add, Mr. Mayor, that we often have vacancies. It happens because we have limitations on terms, and there are vacancies now, I think, currently on different boards and commissions. But I just want to commend you, Mr. Mayor, because our boards and commissions are looking a lot more like Tempe, more representative Tempe. And I really want to thank you for making that concerted effort to be more inclusive in the commission appointments.
Thank you. I appreciate that, council member.
Thank you, Mayor. Thanks, Lauren. I think that concludes the meeting, and I'm sure we will have conversations with some of you, but Mayor, you started this task force, so I think we're going to continue with correspondence by newsletter. Chris Baxter said that they can create a newsletter and we can give updates in that fashion. So we will try that and communicate with folks periodically on the updates that we'll be very happy to share with all of you. Any last words, Mayor?
Just wanted to say once again, thank you to the entire task force for all of your work. I really appreciate it. We recognize it's a lot of time out of your schedule and very busy lives with work and family and other obligations. So just really appreciate your willingness to step forward and do this. I know it's been very, very helpful to me. And to, and also, once again, thank you to our council members, Councilmember Lauren Kuby, Vice Mayor Randy Keating, who agreed to serve on this task force with me. This was the first big initiative out of the gate for me once I became mayor. And so quite honestly, this was very, very critical to the work we were doing. So I really appreciate those two council members for their willingness to step forward and engage in this work alongside me. And just also, clearly thank you to our staff as well, to our Deputy City Manager, Rosa Inchowski, and City Manager Andrew Ching, our Police Chief, Jeff Glover, Human Services Director, Naomi Farrell, and all of the assorted staff members who've been on all of these calls since they first started. We have had, I think about, the chief, Chief Glover, who frankly, I think his second or third day on the job as chief after a pretty short retirement was actually being part of the first Public Safety Advisory Task Force meeting. And the fact that he, jumped in with both feet. And I also know that, there was even one meeting, I think, where he had a death of the family and thought he might not be able to attend, but still found a way to make sure that he was there for his family, but still be part of this meeting, which I think frankly speaks to his commitment to this group and the principles and the values that we've talked about, but also just to the entire, to everyone here, quite honestly, from the task force members to the council members, to members of our staff who frankly, I've had to do all of this process as well through the COVID-19 pandemic and the inability that we had for the majority of the time to meet in person in an effort to keep everyone safe from the pandemic that has really plagued all of us across the world for the last couple of years. The fact that they were able to run this process and still get lots of input and still encourage robust conversation and unpack some very difficult concepts just speaks to the high level of skill and professionalism of our staff. And I just wanted to make sure that they heard that from me very directly. I appreciate all of your efforts and everything you do each and every day on behalf of the city of Tempe. So with that said, I'll go ahead and close out, but thank you to everyone on this call and thank you to the task force members. I greatly appreciate it. I know the entire council does as well.
Thank you, Mayor.
Thank you.
Thanks, Mayor.
Thank you, Mayor. Everybody take care.
Bye, Jacob.
Thank you, Jacob.